You know, this world of the heart and cardiology, I hear you're the man that we should speak with about technology and innovation in that space, but could we kind of walk it back a little bit so our audience can get a general feel for what you do in your field of work?
What I do is very nerdy. We are called cardiac electrophysiologists. So you actually go through 27th grade to get to where you are, which is for the kids in the audience that are just figuring out what they want to do. You go to college, you go to 4 years of medical school, you do 3 years of internal medicine to become a primary care physician if you want to stop there. Then you do 3 more years of heart training, which is cardiology fellowship.
Yes.
And then beyond that, there's 2 years of what we call heart rhythm disorders or cardiac electrophysiology. So we specialize in the electrical pathways of the heart. And that comes into various forms of what we call arrhythmias, which is when the heart is either beating too fast or too slow.
Yes. So the idea that there's electricity in the body may be foreign to some of the folks in our audience. Can you talk a little bit about how electricity creates the movement in our heart to pump the blood so that they understand that part of it?
It is one of the coolest things because the heart has its own battery, if you will, like a pacemaker, and they have their own cells that will actually discharge based on different ion currents like sodium channels, and they basically generate a tiny little spark in what's called the pacemaker cells, and that's what gives you a heartbeat and a heart rhythm. And then what follows after the electrical activation, then the heart then will contract based on how it's stimulated through that impulse. So there are just these impulses that are happening right now. These are called like the autonomic nervous system. You're not thinking about your breathing. You're not thinking about your heartbeat.
Yes.
You could be nervous right now talking to me. You might not be at all, and your heart rate goes up and goes down. It's all regulated by our nervous system.
So far, I feel pretty good. So that's a good thing, I think.
For more information on the innovations shaping our world, visit tomorrowsworldtoday.com, check out the Tomorrow's World Today Facebook and Instagram pages, or subscribe to our YouTube channel.